Today, we are excited to introduce our latest product, QuickFinder COVID-19 and Flu Antigen Self-Test. Please allow me to present quick reference instructions for your convenience. Before getting started, thoroughly wash your hands for a minimum of 20 seconds and carefully review the quick reference instructions. Let's get started. We will take a moment to prepare the necessary materials for the test. In the box, you will find 2 foil pouches and a swab. One pouch contains a test cassette, and the other pouch includes a filter cap and a buffer tube. Open the foil pouch that contains the extraction buffer tube and filter cap. Begin by taking the extraction buffer tube in hand and gently peel off the sealing foil, being careful not to spill the buffer solution inside the tube. Push the extraction buffer tube into the perforated tube holder located at the front of the box, labeled "Insert Tube Here." Meanwhile, please open the pouch that contains the cassette and place the cassette on a clean, flat surface. Make sure you do not touch the sample well of the cassette. Secondly, let's explore the steps for performing the test. After you have completed the necessary preparations to conduct the test, open swab package from the stick end and remove the swab by the stick side. Do not insert the swab any farther if you feel any resistance. Using medium pressure, rub and rotate the swab against the inside of the nostril, making at least 5 circles. Repeat in the other nostril using the same swab. Make sure you've swabbed both nostrils. It's important to collect the nasal sample properly to ensure accurate test results. Place the swab into the extraction buffer tube and completely immerse the swab head in the solution. Vigorously mix the solution by rotating the swab forcefully against the side of the tube at least 10 times, keeping the swab tip submerged in the buffer solution the entire time. Remove the swab while squeezing the tube with your fingers to ensure that the sample on the swab is fully mixed into the buffer solution. Attach the filter cap onto the test tube. Carefully squeeze only 4 drops of the buffer solution into the sample well at a 90-degree angle. Please be cautious not to exceed 4 drops when squeezing the tube into the sample well. Set a timer and wait for 15 minutes before reading the test result. During this time, it's important not to disturb the test cassette, as any disruption may lead to inaccurate results. Well, it's time to introduce how to interpret the test results. Let's start with positive results. If lines appear on C and S, it indicates a positive result for COVID-19. If lines are visible on C and A, this implies a positive result for flu A. If lines appear on C and B, it indicates a positive result for flu B. If lines are visible on C, S, and A, it indicates a positive result for COVID-19 and flu A. If lines appear on C, S, and B, it indicates a positive result for COVID-19 and flu B. If lines are visible on C, B, and A, this implies a positive result for flu A and flu B. If lines appear on C, S, B, and A, it indicates a positive result for COVID-19, flu A, and flu B. For negative test results, if C is visible and there is no line at S, B, or A, you may not have COVID-19, flu A, or flu B. Next, we'll take a look at the invalid test result. If a control line is not visible at C after 15 minutes, even if any other line is visible in the results window, the test has failed and is considered invalid. If the test is invalid, please repeat the test procedure using a new test kit and sample. Let's jump into how to understand the results. For invalid result, this test did not produce valid results and should not be used. It cannot determine whether you have COVID-19, flu A, or flu B. Please repeat the test using a new kit and sample. A negative result means the virus was not detected in the sample. If you test negative but still have symptoms resembling COVID-19, flu A, or flu B, consider seeing a healthcare provider. Positive result means the COVID-19, flu A, or flu B virus have been detected in your sample. Please contact your healthcare provider or local health authorities immediately and follow local guidelines for self-isolation. Report your test result at makemytestcount.org. This voluntary and anonymous reporting helps public health teams understand COVID-19, flu A, or flu B virus spread in your area and across the country, and informs public health decisions. Thank you for testing with QuickFinder COVID-19 and flu antigen self-test.